Hi, I'm Dr. Sunanda Kane, Professor of Medicine in the Department of Gastroenterology and Hepatology at Mayo Clinic in Rochester, Minnesota. And we're going to spend the next few minutes talking about a very interesting study that got presented at the national meeting for the American College of Gastroenterology that occurred last month in October of 2016. And this was a study looking at the levels of Cimzia in breast milk. And if you recall, Cimzia is FDA approved to treat Crohn's disease as well as several other autoimmune diseases. And certainly we know that Cimzia can be used to treat women during pregnancy, but there was not a lot of data about the safety of Cimzia when a woman was postpartum and wanted to nurse. So the investigators were able to use a scientific method to look at drug levels in milk, which is a different kind of methodology than testing drug levels in blood. And what they were able to show was that Cimzia, while present, was in such minuscule amounts that the level was not of any clinical consequence. And what does that mean? So that the authorities on breast milk have determined that if a drug level is less than 10% of what would be considered therapeutic, that is considered compatible or safe for nursing. And it turns out, well, what's the level of Cimzia? And it's 0.13%. So not 10%, 0.13%, which is exceedingly small. And interestingly, that if it's then found in breast milk and the infants are nursing, then in theory it does get into the child. And so what's the concentration of that in the infant? And it turns out that compared to a mother, that the ratio of that drug is 0.003. So the bottom line is that Cimzia does not clinically transfer into milk, and that no woman should be counseled to stop using the therapy in the postpartum period, nor should she be counseled to not nurse if she is on her Cimzia. So I think that those results are very clinically relevant and very reassuring to mothers who are on Cimzia treatment.